We know very little about the Omicron variant, B.1.1.529, but we're starting to learn some things, and by the end of this video, you will learn the good, the bad, and the ugly, when it comes to this virus. The emergence of Omicron. On November 24, 2021, a new variant of COVID-19 was reported to the World Health Organization. This new variant was first detected in specimens collected on November 11, 2021 in Botswana and on November 14, 2021 in South Africa. The UK is facing a substantial wave of Omicron infections in January without further restrictions. Scientists say the number of deaths from the variant by the end of April could range from 25,000 to 75,000 depending on how well vaccines perform. Dr. Nick Davies, one of the researchers, said Omicron was spreading very fast. It is quite concerning. Based on what we're seeing, we can expect there to be a large wave of Omicron in the UK, and it will be the dominant form of the virus in England by the end of the year. The report says the number of people infected is currently doubling every 3 to 5 days in England. These new 5 symptoms of the Omicron variant you should not ignore. Cases so far have been reported to be mild given that the new strain has over 30 mutations in the spike protein, which is unlike any other previous strain. Experts believe it can escape vaccine immunity, which is why it's spreading like wildfire. However, up until now, the cases around the world have been mild. The World Health Organization, WHO, suggests that the newest variant of the SARS-CoV-2 may easily infect those who have either caught the virus earlier or been fully vaccinated. However, the Global Health Agency also states that the disease will be milder as compared to the Delta variant. People suffer from fatigue similar to earlier variants. COVID's Omicron may lead to fatigue or extreme exhaustion. A person may feel overtired, experience low energy, and may have a strong desire to rest, which can disrupt everyday activities. However, it is important to note that fatigue may arise out of other reasons and health problems too. Make sure to get yourself tested to confirm your condition. Patients complain of scratchy throat. As per the South African doctor, Angelique Coetzee, individuals infected with the Omicron complained of a scratchy throat rather than a sore throat, which is unusual. While the two may be similar to an extent, the former may correlate more with irritation of the throat while the latter is more painful. Patients have also suffered a mild fever that goes away on its own since the onset of a novel coronavirus. Mild to moderate fever is one of the telltale signs of COVID-19. But while fever from previous strains had a lingering effect on the patients, the current variant induces mild body temperature that gets better on its own. As per Dr. Coetzee, there could be night sweats and body aches. In another update by South Africa's Department of Health, General Practitioner Dr. Unban Pillay listed down the symptoms patients were experiencing. He suggests that night sweats could be telling symptoms of the new Omicron variant that may arise at night. Night sweats occur when you sweat so profusely that your clothes and bedding become wet even if you're laying down in a cool area. This, according to the doctor, could be accompanied by other symptoms including lots of body pain. Evidence of dry cough. Apart from that, the doctor suggested that dry cough may also surface in people suffering from Omicron. It was one of the most common symptoms in previous strains as well. A dry cough is when you force out a hacking sound to clear any irritation in the throat or airways. Newer evidence documented suggests that the new Omicron variant only triggers mild symptoms. As opposed to symptoms from the previous variants, the Omicron variant is believed to show no signs of loss of smell and/or taste, and there have been no cases of a stuffy, clogged nose, and those affected by the new strain have not complained of very high temperature. Answers to some of your questions about Omicron. How easily does Omicron spread? The Omicron variant likely will spread more easily than the original COVID-19 virus. CDC expects that anyone with Omicron infection can spread the virus to others, even if they are vaccinated or don't have symptoms. Will Omicron cause more severe illness? More data are needed to know if Omicron infections, and especially reinfections and breakthrough infections in people who are fully vaccinated, cause more severe illness or death than infection with other variants. Will treatments work against Omicron? Scientists are working to determine how well existing treatments for COVID-19 work. Based on the changed genetic makeup of Omicron, some treatments are likely to remain effective while others may be less effective. Do masks offer protection against all variants? CDC continues to recommend wearing a mask in public indoor settings in areas of substantial or high community transmission, regardless of vaccination status. Tools to fight Omicron. Vaccines remain the best public health measure to protect people from COVID-19, slow transmission, and reduce the likelihood of new variants emerging. COVID-19 vaccines are highly effective at preventing severe illness, hospitalizations, and death. Scientists are currently investigating Omicron, including how protected fully vaccinated people will be against infection, hospitalization, and death. CDC recommends that everyone 5 years and older protect themselves from COVID-19 by getting fully vaccinated. CDC recommends that everyone ages 18 years and older should get booster shots. Here's the truth about the new COVID-19 variant Omicron to the newly identified strain found in South Africa, where it's caused a spike in their population, leading us to believe that it's potentially more transmissible. A lot of unanswered questions here that we need to get, and we need to stay alert, not anxious. Number 1, we don't know how severe the cases will be with this new variant, because it takes a few weeks to figure out the hospitalization and mortality rate. Also, we don't know how this virus will behave in individuals who've been vaccinated and individuals who've recovered from other variants of COVID-19. And until we find that out, we don't know the implications of this variant. It's important for us to stay alert, not anxious, not fall victim to the sensationalist headlines, to the statements by pharma CEOs trying to predict the future, and let information and science guidance. And where science guides us right now is to get vaccinated, because it's the low vaccination rates which leave us susceptible to the emergence of new variants.